Hi everyone, in this video we'll be focusing on epidemiology and family studies. Okay, now have you ever wondered how scientists figure out why diseases occur and why diseases even spread? Who gets infected by a disease? And how do outbreaks even occur and how are they stopped? Is that okay? All these are concepts in epidemiology. Okay, now epidemiology basically, is the science that studies who, what, where, when, and why health and disease in a population occur. Okay, now in this video, I'll try to break down complex epidemiological concepts into very simple and with practical examples. Okay, so that you can understand not just the numbers, the calculations, not just that, but you'd know the story and the reasons behind all these concepts. Okay, so whether you are a midwifery student, you are a nursing student, you are a public health enthusiast, or you are just curious about getting to know more about epidemiological concepts, then this video is going to, or this lesson is going to serve as a foundation for you to be able to think like an epidemiologist. Now let's get started. Epidemiology. Now what is epidemiology? Epidemiology basically is the study of the distribution, the patterns, and the determinants of health-related states or events in a specified population, and application of this study to the control of health-related problems. Now, there are key things here that you need to pay attention to. In epidemiology, the focus is the study of the distribution. The distribution in the sense that how a disease is spreading. That is, if we are looking at a particular condition, okay, or an event, how that event, for example, a disease is spreading. What is the pattern? So, for example, if a certain disease occurs in a particular population, how many people are being affected? Among those who are affected, how many of them are elderly people? How many of them are children? That is the pattern, the trend. Is that okay? So epidemiology focuses on distribution of diseases. How is the disease spreading? What is the rate? You get it? How is the disease spreading? How many people are getting infected? What is the pattern? Among those who are getting infected, how many of them are in the rural communities? How many of them are living in an urban community? Okay, how many of them are women? How many of them are males or are men? Okay, the pattern. Okay, so epidemiologists look at the distribution, the pattern, and the determinants. Now, those who are getting affected, what is the reason? Why are they getting affected? What are the factors behind? Those are the determinants. Okay, so epidemiology is the study of the distribution, the patterns, and the determinants of health-related states or events in a specified population, and the application of this study to control health problems or to solve health-related problems. Practically, that is what epidemiology is all about. Now, epidemiology can also be seen as the science that studies how diseases occur and spread in populations. Why are some group of people more affected than others? So if you take a particular disease, okay, why are some group of people, what's the reason behind why some group of people may be affected by the disease? Okay, why are some people being affected? Why are other people not affected? Okay, if a particular condition is spreading among a particular population, why is the disease spreading in this population and another population, the disease is not occurring? Okay, epidemiology focuses on all those things. So the science that studies how diseases occur and then spread in populations, why some groups are more affected than others, and how this knowledge can be used to prevent and control health-related problems. Okay, so in summary, the focus of epidemiology is to look at how diseases are distributed, okay, and the pattern of the distribution. So if a disease is spreading, what's the nature of the spread? Okay, which specific area is the disease occurring? So you can have a certain community, community A, community B, community C, and a disease can occur in if these communities are forming a particular region, the disease can occur in a region, and the pattern will be that it may be occurring only in community A. That is the pattern. Okay, so we look at, in epidemiology, we are going to look at how disease is being distributed, the pattern of distribution, which people are getting affected by the disease. Is it the elderly? Is it children? Is it pregnant women? Is it those living in overcrowded areas? The pattern of the spread of the disease and the determinants, those who are getting affected. What are the factors that is making them to be infected, to get affected by the disease? What are the factors behind? What are the reasons? What are the determinants? Is that okay? All that are areas that epidemiology would focus on. Okay, now epidemiology comes from the Greek words epi. Epi means upon. Demos means people. And then logos means study or discourse. Okay, so literally, epidemiology is the study of what is upon the people. What is upon the people. Okay, what is upon the people. Now, like we said earlier, epidemiology is the study of the distribution and determinants of disease in a population. Now, for malaria, let's look at malaria as an example. For example, if malaria is occurring in a particular community, let's use malaria as a case study to break down the definition of epidemiology. Now, for malaria, if you look at malaria as a case study, okay, in terms of distribution, epidemiologist is going to be interested in who is getting affected by malaria. Is it children under 5 who are getting affected by malaria, or is pregnant women who are getting affected by malaria? Now, epidemiologists will also be interested in where. Okay, where. So under the distribution, epidemiologists will be interested in who is getting affected. Okay, are elderly people being affected by the disease? Are children being affected? Are pregnant women being affected? Who is being affected under the distribution? Now, also under the distribution, epidemiologists will be interested in what? The where. Where is the disease occurring? Fine, the disease is affecting children, but where? In which community? In which area? Is that okay? Epidemiologists will study all those things. Then epidemiologists will now look at the determinants. The determinants in epidemiology, how are they going to get to know the determinants? They ask questions, they ask the why questions. So if an epidemiologist asks the why questions, then they are looking for determinants, the factors. Determinants are the factors. Okay, so for example, those who are getting affected, is it because they are exposed to, let's say, mosquito bites? Or is it because they lack bed nets, insecticide-treated bed nets? Or is it because of poor drainage systems? Okay, the why questions. So you see, epidemiology broadly look at two things: distribution and determinants. So under the distribution, that's where we look at the patterns. So which people are getting affected? Is it elderly people? Is it children? Is it pregnant women? Is it people who have a particular disease who are still getting affected by another disease? Okay, the distribution. Okay, among which people is the disease occurring? Epidemiologists under distribution will also look at where. Where is the disease occurring? Is the disease occurring in an area where they are overpopulated? Is the disease occurring in an area where they are overcrowded? Do you get it? Where is the disease occurring? All that comes under the distribution. Then the determinant. Why? What is the reason? Why the people who are affected, why are they getting affected? What are the reasons behind? Is that okay? And now, if epidemiologists ask all these questions, at the end of the day, they are going to get information. That information is knowledge. Okay, so the knowledge, okay, health workers, health professionals, policy makers can utilize that knowledge to plan or develop policies or plan interventions. Is that okay? Interventions, for example, in the case of the malaria scenario, they can use it to plan interventions like distributing insecticide-treated nets, spraying breeding areas, and also educating family members. Okay, then with this, they can help to eradicate the disease in that particular community or locality. Okay, so that is all that epidemiology is about: the study of the distribution and determinants of what diseases in the population, and the application of the knowledge that you've gotten from that study in the planning or the development of interventions to solve health related problems. That is all that epidemiology is about. Now, what are the importance of studying epidemiology? Why is it important to study epidemiology? Now, like we said earlier from the definitions, now studying epidemiology would help you to understand disease patterns. Okay, so for example, if you take a particular disease and you are looking at it from the epidemiological point of view, now you are going to learn about the distribution of the disease. That will help you to understand the pattern of the disease. The pattern, okay, if you take a disease like malaria, the pattern will mean who is getting affected. Are pregnant women getting affected? So that will help you to know that, okay, this very disease, these are the population that is being affected the most. So epidemiology will help you to understand disease pattern. Now, you remember epidemiology also look at the determinants. So in studying epidemiology, if you take a particular disease, it will help you to identify the risk factors of the disease. Okay, and like we said from the definition, epidemiology can help guide prevention and control of diseases in a population. Okay, because epidemiology will give you evidence. Because if epidemiology is asking questions, the why questions, to get reasons, to get the factors. Now, if we know the factors, we can, based on the factors, to, guide prevention and control. Because if you take a case like malaria, epidemiology asks questions on, let's say, who is getting affected, why are they getting affected, and now we have evidence of the factors that we think are leading to the occurrence of the disease. Then we can better plan preventive measures and control measures. Okay, now again, epidemiology can also help to improve patient care and nursing practice. Okay, epidemiology can help to improve midwifery practice, patient care, and midwifery practice. How is that possible? It will enable health workers to understand how lifestyle and even our environment, okay, and genetics can affect patients, patient condition. Is that okay? Epidemiology will give you that understanding. Now, epidemiology would also help in early detection of outbreaks. Okay, now in studying epidemiology, you understand how outbreaks are investigated. Now, one of the areas in epidemiology is outbreak investigation. Now, in studying epidemiology, you are going to understand outbreak investigation, how outbreaks are investigated. And in doing that, you'll be able to detect outbreaks early. And if you are detecting outbreaks early, you will be able to, put in place interventions. Okay, timely interventions so that the outbreaks does not get out of hand. Is that okay? Then, studying epidemiology can also help ensure efficient use of health resources. Okay, so because data from epidemiology ensures scarce resources are targeted to the most at-risk group. Okay, so that's the importance of studying epidemiology. Now, as a nurse or midwifery student, how can you apply epidemiology? The application of epidemiology in nursing and midwifery. Now, epidemiology can help you as a nurse or midwife to identify health needs. Okay, so nurses and midwives use epidemiology to know who is at risk in the community. Example, children under 5 prone to malaria, pregnant women prone to what? Anemia. So for example, if you take a condition like anemia in pregnancy, okay, now in anemia in pregnancy, for example, you can study, epidemiology can study trend and say that, most pregnant women within a certain, let's say, gestational age, they are developing an anemia. That is an example. They are developing an anemia. Then epidemiologists can help to identify needs. Okay, so you can, based on that distribution or that trend, and be able to plan. Okay, so that you know that, okay, if a pregnant woman is getting to this gestational period, it is likely that they will develop anemia. So you start planning. You consider that as part of their needs, and you base on that to plan ahead. Okay, good. Epidemiology can also help in planning and prioritizing care. Yes, for example, let's say we have two communities, community A and then community B. Now, in community A, 50 people are getting malaria. In community B, nobody was infected by malaria. Now, if in case, let's say, there is distribution, you have to distribute resources to help solve issues to malaria, you are going to consider the community that was infected the most. Is that okay? You are going to consider that in your planning. Obviously, they are going to have to receive more of the resources. Do you get it? So, studying epidemiology, getting to know about diseases, the patterns, how they are occurring, which people are being affected, why it is occurring, all that can help you with planning and prioritizing care. Okay, because it can help you guide allocation of limited resources. Example, distributing mosquito nets in endemic zones, areas that they are getting affected by disease. Distributing mosquito nets, focusing antenatal care on high-risk mothers. Is that okay? So you are the antenatal clinic. Mothers are coming. Is that okay? Mothers are coming to the clinic. Now, you have to focus your care on the high-risk mothers. The mothers who have certain, critical conditions. Okay, epidemiology would help you appreciate that, no, these people, they actually need your attention. So you have to focus your care, pay more attention to them. Okay, good. Epidemiology will help you to appreciate all these things. Now, epidemiology would help assist you with health education and promotion. Okay, so for example, let's say there a particular community, a lot of people are reporting to health facilities around the community after getting infected by a particular disease. Now, if it happens that as part of your plan, as maybe part of the directorate or part of the team, okay, now you can consider educating the members from that community on the condition. Is that okay? You can consider educating them specific to that very condition. That will help you, because you see, let's say you take a community and let's say malaria is very common in that community. People are getting infected. The numbers are increasing. Now, if it happens that you have to plan education in that community, malaria should be one of the, the subjects or the areas you have to educate the people about. Because, so for example, if malaria is affecting people, a lot of people are getting affected. You are going to educate these people. Then you choose to educate them on conditions that are not even occurring in the community. No, that is misplaced, completely misplaced. You have to educate them on conditions that are occurring in the community. Okay, so during health education and health promotion, epidemiology comes to play. Is that okay? Good. Now, another thing is disease prevention and control. Nurses and midwives apply epidemiological data to implement immunization, screening, and infection control practices. Again, epidemiology helps in evaluating nursing interventions. Okay, good. Epidemiology helps assess whether programs work. That is, did maternal mortality reduce after scaled delivery interventions? Okay, good. Now, the seed point is advocacy and policy influence. Nurses and midwives use epidemiological evidence to advocate for better policies. Example, improve maternal health services and save water supply. Okay, great. Now, questions epidemiologists usually ask. Now, remember one thing, that epidemiologists are like detectives. Okay, you can call them health detectives. Okay, health detectives. Or you can use the word health researchers. Okay, so epidemiologists, they are like detectives. Okay, so anytime a new disease occurs, or every time a new disease occurs, epidemiologists, they come in as detectives. Okay, the only difference is that, detectives, as we know, they usually carry guns, or they carry magnifying glasses that can help them to see clearly. Okay, but epidemiologists, they don't carry all these things. They only carry their questions. Okay, so when a disease occurs, epidemiologists, they step in, and they step in as detective. They are going to detect. Okay, they are going to find out why the disease is occurring. Okay, so they step in as detectives. Okay, the only thing is they do not carry guns. They do not also carry magnifying glasses like detectives do. They come in with their questions. They come and ask questions. Is that okay? Now, so we have in epidemiology, epidemiologists usually ask 5 questions that you need to know in epidemiology. Now, the reason why they are asking questions, why are they going to ask questions? Now, if epidemiologists don't ask questions, they won't get information. And that's the reason why epidemiologists comes to a conclusion by way of asking questions. So they ask questions. The questions they ask specific questions, right questions. Is that okay? To help them uncover the risk factors, to help them uncover why the disease or where the disease is spreading, to help them uncover when the disease peaks. Meaning, when are we recording high cases? When are we recording low cases? Okay, and then why the disease occur? What are the factors behind the occurrence of the disease? Is that okay? So let's look at questions epidemiologists ask. The questions that epidemiologists usually ask. Okay, so usually epidemiologists ask 5 questions. The first one, we have the who question, we have the what question, we have the where question, we have the when question, and then the 5th one, we have the why or how questions. Okay, so we have the why questions, we have the who question, we have the what question, we have the where question, we have the when question, and we have the why or how questions. Okay, so in fact, these questions, they are questions that you need to know in epidemiology. And these are questions that are going to help epidemiologists to get the information that they need to help them, render interventions, or to help them, to guide them with policy development or the development of interventions. Is that okay? So the who question. What is the who question about? Who, when epidemiologist is asking a who question, the idea is that they want to know which people are affected by a disease. So if, let's say, epidemiologists hear that a particular disease like malaria has occurred in an area, if the epidemiologists come, they will ask the who question. Now, the reason for asking the who question is to help them know which people are being affected by the disease. Which people are being affected. Okay, which people are being affected. Now, the people that are being affected, how old are they? Are they children? Are they elderly people? What is their sex? Are they males that are being affected, or are they females that are being affected? What work do they do? Are they bank managers? Are they nurses or health practitioners? Okay, are they working at the construction site? Are they engineers? Are they traders? Are they market women? Okay, the who question. The who question, they ask the who question to help them know which people are being affected. Is that okay? Now, to add to that, usually the who question is just to help the epidemiologists to know or identify the higher risk population. Okay, so if you take a particular area and a disease is occurring, when we ask the who question, it will let us know those who are at higher risks of getting the disease. So it will help the epidemiologists to look through the situation and get to know which people are actually at higher risks of the disease. So the who question is about which people are being affected by the disease. Are men being affected? Even if it is men who are being affected, is it married men or married men? Okay, if it is women that are being affected, okay, is it adolescents? Okay, or is it teenagers that are being affected? Is it infants? Is it elderly people that are being affected? The who question will help us to know which people are being affected, and even the background of those people that are being affected. Now, epidemiologists also ask this second question, the what question. The what? Okay, the what question, what is this about? What is the disease or the health condition? What is the disease or the health condition? The what question will help the epidemiologist to know what the disease is. In fact, the what question will actually help the epidemiologist to define the disease, get to know what the disease is, what are the causes of the disease, what are the signs and symptoms of the disease. So if epidemiologists ask the what question, they want to know what disease it is. What disease is spreading? What is the disease? What are the causes of the disease? Okay, what are the signs and symptoms of the disease? Okay, what are the characteristics of the disease? Okay, the what question. So if epidemiologists ask the what question, what is the disease or the health condition? What is the disease? What is it? What is the disease about? Okay, how does the disease look like? What causes the disease? Now, the what question will help the epidemiologist to define the condition, get to understand the condition and be able to define the condition properly. That's the what question. Okay, then epidemiologists can also ask the where question. The where. Now, where question, what is the intention of the epidemiologist? Now, epidemiologists want to understand where is the disease occurring. Where? Which region is the disease occurring? Which country is the disease occurring? The disease, is it occurring in rural areas or is the disease occurring in urban areas? Which specific communities is the disease occurring? The where question. Where? Where is the disease occurring? Which region is the disease occurring? Which country? Is the disease occurring in rural areas or is occurring in urban areas? Which specific communities is the disease occurring? Where? The where question. So if epidemiologists ask the where question, they want to know where the disease occurring. Okay, so a particular disease occurring. Okay, is it occurring in senior high schools? Is it occurring in tertiary schools? Is it occurring in Greater Accra region alone? Is the disease occurring in, let's say, a particular region in a country or a particular state in a certain country? Where is the disease occurring? The region, the country, rural or urban areas, the specific communities where the disease is occurring, the where question. Okay, so if epidemiologist is asking of the where question, the whole idea is they want to know where the disease is occurring. Okay, now epidemiologists would also ask this question called the when question. When the disease is occurring. Now, if epidemiologist is asking when, they want to know when the disease is happening. Which season of the year is the disease occurring? Okay, in fact, what year is the disease occurring? Is the disease occurring? Are a lot of people getting affected in 2024? Is an outbreak occurring in a certain period? Okay, so epidemiologists want to know when. Is the disease occurring in dry season? You know, we have some diseases that in literature we've come to know that the disease occur in dry season. There are some conditions that per literature we've established that they occur in rainy seasons. All that was as a result of epidemiological studies. Is that okay? So epidemiologist is interested in when. When is the disease occurring? Okay, what season is the disease? During which year is the disease occurring? What was the year? Is that okay? When? The when question. Okay, then lastly we have the why or how question. The why or the how question. Now, what is the why question about? The why is the disease occurring? In fact, the why question would help the epidemiologist to be able to know the factors behind the occurrence of a disease. What are the factors that are behind the occurrence of the disease? Okay, what are the factors? In fact, if you say the disease is spreading among aged people, why is the disease spreading among aged people? What are the reasons behind? Is it because their immune system have gone down? The why question will help you, or the how question would help the epidemiologist to get that information. Okay, why is the disease occurring? How is the disease spreading? Is that okay? Why? In fact, the why question is just meant to help the epidemiologist to understand the factors behind the occurrence of a disease, the risk factors behind the occurrence of a disease. Okay, good. So remember that epidemiologists are more like detectives. Okay, the only difference is that they don't use guns and magnifying glasses. they use their questions. And epidemiologists usually ask 5 range of questions: the who question, the what question, the where question, the when question, and then the why or the how question. Now, the who question would help the epidemiology to get answers for which people are being affected by the disease, which people are being affected by the disease. So if we enter a community and we get to know these community members, a lot of people are reporting with anemia. You ask questions: which people are being affected by the anemia? Is it pregnant women? Is it elderly people? Is it children? Even if it's pregnant women, who is being affected? The pregnant women, is it first time pregnant women or pregnant women who have given birth previously? Okay, now the who question will help you to know which specific group of people are being affected by the disease. Okay, so ideally it will help you to know which people are actually at risk of the disease. Okay, now the what question, the what question would let the epidemiology get to know what disease we are dealing with, what condition. It will help you to define the condition. Okay, then we have the where question. Where is the disease occurring? Which country is the disease occurring? Which region is the disease occurring? Is the disease occurring in rural areas? Is the disease occurring in urban areas? Which specific communities is the disease occurring? Okay, in fact, the where question would help you, the epidemiologist. It will help you to understand the geographical patterns of the disease. If you say geographical patterns of the disease, which specific areas or which localities or which specific areas in a particular region is being affected, the geographical patterns. Is that okay? Great. Then again, epidemiologists also ask the when question. When is the disease happening? When is the disease occurring? Okay, what season of the year is the disease occurring? In fact, what year is the disease even occurring? Is that okay? What are the trends of the disease? Does it occur between certain months period and then at the end of the day it subsides? How is the trend like? When is the disease occurring? What time is the disease occurring? Okay, epidemiologists will also ask their last question, which is the why or how question. In fact, the why or how question would help the epidemiologist to understand why, the reasons behind the occurrence of the disease. What are the reasons? What are the factors behind the occurrence of the disease? Okay, in a certain population. Is that okay? So we will end over here for this series. I would encourage you to subscribe to the channel. Okay, click on the like button and make sure you put in a comment. If you have questions, you can put in your questions, and make sure you share this content to your family and your friends. Okay, I wish you all the best. See you in the next lesson. Bye bye.